Hi everyone, welcome back to Fertility Friday. Today we'll be talking about the menstrual cycle and how having regular periods is important to achieving pregnancy. It's important to understand how a normal menstrual cycle works in order to understand what is needed for conception to happen. A normal menstrual cycle, referring to the interval of time from one menses to the next menses, ranges from 21 to 35 days. Cycles in this interval strongly suggest ovulation, and a cycle that falls outside this interval strongly suggests ovulation dysfunction. Having regular menstrual cycles and regular ovulation is very important because a pregnancy cannot occur without ovulation or the release of the egg. The menstrual cycle involves a series of coordinated hormonal events between the brain, the ovary, and the uterus, with the goal of releasing an egg each month and preparing the uterus for a pregnancy each month. The cycle can essentially be divided into two phases, the follicular phase and the luteal phase. The follicular phase starts with the first day of the menses and continues until ovulation. The luteal phase starts with ovulation and continues until the next period. At the beginning of the cycle, or first day of your period, GnRH is secreted from a certain part of the brain called the hypothalamus. This will stimulate the pituitary to make FSH and LH. FSH stands for follicle stimulating hormone, and it will travel through the bloodstream to the ovary and stimulate the ovary to grow a follicle, which has a growing egg within it. As the egg matures, the follicle will produce estrogen, and this estrogen will circulate back up to the brain and suppress GnRH, FSH, and LH in a negative feedback mechanism. The estrogen will also stimulate thickening of the uterine lining, which will help for later implantation. The length of the follicular phase can vary, in contrast to the luteal phase, which typically does not vary. When the follicle is ready to ovulate and release the egg, a certain threshold critical level of estrogen is reached, and that negative feedback mechanism switches to a positive feedback mechanism, and this will stimulate a surge in GnRH, FSH, and LH, and the LH aspect of this is also known as the LH surge. Ovulation will occur approximately 24 to 36 hours after the LH surge, and the egg is viable for an additional 24 hours after ovulation. The next phase is the luteal phase. In this phase, the remnant of the follicle becomes a corpus luteum, and this will produce estrogen and progesterone. The progesterone prepares the uterine lining for implantation of an embryo. If a pregnancy occurs, beta HCG will rescue the corpus luteum and will stimulate continued estrogen and progesterone production from the corpus luteum. If a pregnancy does not occur, the corpus luteum will regress, and estrogen and progesterone will decline, resulting in a menstrual cycle. The luteal phase is usually 12 to 14 days in length and should not vary. Normal cycle lengths are important in assuming all these hormonal changes are happening properly, that ovulation is occurring, and that the uterus is prepared for a pregnancy. If cycles are irregular, you can assume ovulation is not occurring, and you should consider seeing a fertility specialist for assistance with helping you ovulate. Hey guys, thanks for watching. I hope you enjoyed the content. You can always follow me on Facebook, Instagram, or YouTube, and now on TikTok under the handle Kathiresan MD. Thanks again, and see you next time.